Good afternoon, Department of Behavioral Health, and welcome to the COVID-19 and general update. I am Susan Holt, for those of you who don't know who I am or who don't remember who I am, and I'm happy to be here again today. Last week we did mention that we are going to send out a survey, and we're working on that this week and hope to send that out early next week to get your input about this weekly update. And that will help us kind of drive forward in 2022 how we will communicate with you, how frequently, what content we cover, etc. So do be on the lookout for that. Before we jump into our COVID-19 data, I do want to pause here and just remind us again of the very important observance of Martin Luther King Jr. holiday on Monday. It is a federal holiday and it's a day off for county employees, and so really want to encourage you to watch that video that was sent out by Dennis Horn, our cultural diversity, our diversity services coordinator. There's so much great information in that video, and it's really an important way for us to lean into this important date to remember and honor Reverend Dr. Martin Luther King Jr. and all of the important work that he did, really furthering and advancing civil rights for all, and really a forerunner in equity work in our country. So I do encourage you to look at that video and spend some time in reflection. So without further ado, we'll lean into our COVID-19 data. We usually start with that early in our presentation each week. And for some reason, I was having trouble advancing slides. Thank you for your patience. So COVID-19 by the numbers, I pulled this information today. So last week we reported total cases for COVID-19 were at about 298 million. And on this slide we showed today we are just over about 389,000 over 317 million. So a pretty good jump. Next we see here in the United States, last week we were at 58 million cases, and this week we're at just over 63 million. So again, a sizable jump. Now let's lean in a little bit on California, our home state here. So we're seeing some shifts here as well. Last week, the daily average of vaccines, you might remember I was very alarmed about the big drop that we had in the daily average doses of the vaccination. I do know people are busy doing other things around the weeks of the holidays, but we did have a sizable decrease last week. We are up a little bit from there. So last week we were at 142,000 and change daily average, and we're up a bit to 182,055 daily average vaccinations administered. So that's going in a good direction. Later toward the end of the presentation, I'll show you our Fresno County percent of our population that's vaccinated, so we'll come back to vaccinations. Our case rate, our daily average last week was 36,282, and so you can see now we're up to 69,000, and that's a big jump. Deaths, we were at 44 daily average when I reported out last week, and a small uptick there, 47. And then test positivity hasn't shifted a whole lot, just at 23.1%, up a tiny bit from last week. Moving on to hospitalization trends. So we had about 104 people more this week hospitalized compared to last week's data. So that's a really big jump in people hospitalized. Not as big of a jump with ICU. So ICU, we're up by 19 people. But the ICU capacity is relatively stable. Of all of the total ICU capacity, we still have 10 ICU beds available. So I'm going to talk a little bit about how we can all help our colleagues in the hospital system. And then after that, I'll share a little bit of grounding or context information comparing where we are with hospitalizations this year compared to the winter surge that we saw last year. So this week, our EMS system here in Fresno implemented what's called Assess and Refer policy. So what this means is it's the ambulance system responding to what we're seeing in our emergency departments. in order to help preserve emergency department beds for the people who are the most critically ill and the people who have emergent medical conditions. So sometimes we in the community call 911 and an ambulance comes, but we may not actually have a medical condition. I've had that happen in my family where, the ambulance has come, they've done a thorough evaluation of the medical situation, and the person actually didn't need to go to an emergency department. Our EMS colleagues have had longstanding practices in our community that when someone asks to go to the hospital, even if it's not necessarily something they think is medically necessary, they have transported. But in certain unique situations, our EMS director indicated 4 times since the challenges of last year, they'll implement this policy of assess and refer, whereby if the person who is before them is assessed medically to not have an emergent medical condition that requires transport to an emergency department, they will provide them with other resources in the community to meet their needs and refer them to those resources. Also in the next, possibly by now, but since I last spoke with our emergency medical services director, the plan was to implement at our emergency departments what's called an ambulance patient offload team. And this is a new resource that could come to Fresno or maybe here already to help our EMS system get the ambulances back in the field quicker. When the hospital has a lot of people at the emergency department, whether it's COVID or other issues, it takes a long time for the person in an ambulance to be transferred to the emergency department staff. And so we really want to speed that up so that those ambulances can get back out into service. And so through some resources coming to Fresno, the ability for another team to receive the person in the ambulance is a great resource. So you cannot, if you're in an ambulance, if you're a paramedic, you can't just drop and run, right? You have to have a medical team that you're transferring the care to. And so these patient offload teams would be a resource to be able to receive patients from the ambulance and then get them back out into service. The areas where this could be really valuable is in particular for our rural communities because, if you're out in Sanger, for example, or other parts of the rural communities, it's a bit of a drive to come into Fresno or Clovis to go to an emergency department. And so this new resource will help us make sure that all persons who have emergency medical needs are getting those needs met. And lastly, I want to remind all of us about the importance of, not just for ourselves and our family, but for those that we serve, reminding people that there are other resources available for medical care in our communities, whether that be primary care offices, federally qualified health clinics, and urgent care centers. If we don't have an emergency medical condition, it is better for our whole health system if we get those needs met in an urgent care office or through primary care, so that we save those very precious emergency beds for people who have emergency medical needs. And again, I'm not just talking about COVID. So if someone has an acute appendicitis, that is an emergency medical situation and they need to be treated very timely. Persons who are in car accidents, for example, people who have heart attacks, etc. So I really want to encourage all of us to remember that the emergency departments are really truly for medical emergencies. With that said, here's a slide that has the data I mentioned that compares where we are with this year's winter surge of COVID and what we know to be the Omicron variant in particular, compared to last year's winter surge that we saw. So the data is really, really tiny, so I'm going to tell you what is on the left side of the slide is people from December 14th of 2020 through January 8th of 2021. 2021. That's the slide, that's the part of the slide on the very left with the taller blue numbers. On the right, that's this year's winter surge. That's December 15th, so just a month ago or so, and that's through January 8th, which was, of course, just last week. And so what you can see from this information is that even though we are in a significant surge, and even though our hospitals really are having a hard time keeping up, particularly in the emergency departments, it's not nearly the impact in the hospitals that we saw last year. So remember, last year we didn't have the vaccine over the holidays for most of the general population. So we also know that Omicron variant is highly contagious, but doesn't result for most people in as severe of an illness. So there's a few variables that are influencing this data. But I did want to share this slide because Public Health shared it with me, and I do think it's really important for us to stay grounded in context as we're managing this surge. So comparing Fresno then next to California, I've mentioned in the past two presentations, I really like this slide because I like to see kind of how are we faring in the context of our state. And on the very right-hand side of the graph, I know it's small, but the blue line, which is California, is going all the way almost to the tippy top of the graph. It's over 100, it's 108.7 case rate per 100,000. So that's a really significant number. And if you see the orange line, that's Fresno, and we're at 39.5 case rate per 100,000. So there's a really significant difference between what we're experiencing here locally in Fresno compared to what's happening across the state. Our tier, however, remains purple, as are all of the counties in the Central Valley. So the slide I just put up right now is a comparison of the state with just our Central Valley region. And just similar to what we've seen through the last few weeks, Fresno is about in the middle of the pack for the Central Valley counties. And I said I'd come back to vaccinations and let you know how we're faring here in Fresno County in terms of our total percent of eligible persons who are vaccinated. And we're at 67.7% this week. Now that's of all total eligible persons, including children who are eligible for the vaccine, residents over the age of 5. So 67% is lower than we would like to see. I do want to pause and recognize that vaccination is an individual decision. We've talked about that many times here in these updates. And vaccinating children is a family decision. It's an individual family decision, and I want to empower parents and caregivers to really learn the research and the data to make an informed decision. Everything that we've seen so far encourages me to have great confidence in the safety of the vaccine. All of my relatives who are age eligible, all of the children in my life are vaccinated, just for full disclosure. But I do want to appreciate that it is an individual decision. If you or others have concerns or questions, the Public Health Department has a lot of great information. And so I encourage you to reach out if you have questions about vaccinating minors. Also, another great option is to talk to your healthcare provider. Your child's pediatrician is really the person who knows your child's health the best and can help you make those decisions as well. More about vaccinations, popular topic as we are as healthcare providers under a new mandate. We talked about this last time. Governor Newsom's office announced the booster requirement. So reminder that next Tuesday is when all of those who are under that initial health order for vaccination are now under the December 22nd order for the booster vaccination. So we have to be vaccinated with that booster shot by February 1st. As a reminder, that's for booster eligible folks. So if you had, for example, Johnson & Johnson, you have to have 2 months pass by before you can have a booster. Then you're booster eligible. If you had Pfizer or Moderna, it's 6 months that has to pass by from your second dose before you're booster eligible. So if you are booster eligible and you don't provide evidence, by last week, you actually have to be tested once a week. So if you did not provide evidence of your booster vaccination, then you needed to test this week. So got until the end of the day tomorrow, I guess. And then again next week until you are vaccinated. So February 1st gives you until the end of business on Tuesday. And in order to submit that verification, just a reminder, there's a Relias module for all DBH employees. It's really easy to upload. I mentioned that last week, and I can attest to you that I did it, and it's really easy, and I'm not particularly tech savvy, full disclosure. And so if I can do it, any one of us should reasonably be able to upload our booster information. If you have a hard time, if there's a technical glitch or you have questions, absolutely feel supported to reach out to our DBH HR team. They are very responsive, and I have to give a big shout out to that team. Every time there's one of these new mandates, it takes tremendous resources to help our department manage that, and they're doing a great job. Do be patient if it takes a little bit of time to respond to an email. They'll get to you. They're highly responsive and really knowledgeable, so they'd be happy to walk you through any questions. Those boosters are available in the community. You can utilize the website myturnca.gov, and also we do have our vaccination clinic at Metro, and I'll talk a little bit about that later. Let's turn our attention to masking. So there's a lot of questions about masking right now, and so we do know that the guidance has been updated. I'll talk about that as well. This information I pulled from one of the links in the email that Helen Herrera sent out this week, clarifying expectations related to masking. So I have several slides related to masks. We have a continuum of protection based on the type of mask that we wear. On the very right-hand side, the least effective option is a fabric mask. So many of us early in the pandemic couldn't get our hands on surgical masks, and lots of folks started sewing and creating cloth masks, and then the internet was just booming with cloth masks that could be bought from various websites. What we know from the Omicron variant is that it's penetrating through those cloth masks differently, and so the new guidance is that as much as possible, we should move up a level to surgical masks. Those are more effective than cloth masks. If you go up another level, even more effective is the KN95, the KF94, fitted surgical masks, or double masking. And then, of course, the most effective is the N95. So CDC and California Department of Public Health did update their mask guidance and are recommending as much as possible that we use a surgical mask or the N95. The most important thing though, and if you look at those links that Helen sent out, the most important variable is the fit of your mask and the ventilation. So the tighter the fit, the less likely that air and particles will get through your mask. And you also need to be able to have ventilation. The less ventilation, the less particles get through, but let's remember we still have to be able to breathe. Really important there. So double masking is another effective way to improve fit and filtration. So for example, if you have a surgical mask, you can actually take a snugly fitting cloth mask and put it over your surgical mask. That gives you that additional layer of protection, and it helps to improve the seal of the surgical mask. Another thing I want to highlight though is that layering more than 2 masks is not recommended. Again, we really need to be careful that we're not compromising our ability to actually have oxygen in our body. And then it's not recommended that you wear 2 medical masks. I want to talk a little bit about the importance. If you see the slide still, you can see I've underlined a part of the slide where it says you must cover your mouth and your nose. How many of you out there, I can't see you, but raise your hand if you've been out somewhere and you see people wearing their mask right here, like this, under the nose. Please don't do that. That is not effective at all. You have to cover both your nose and your mouth. We talked last time about some of the cloth face coverings have gotten stretched out over time, and I know I've had to discard many of mine because they've gotten too loose. We do need to have a snug fitting mask, and it needs to cover both the nose and the mouth, and ideally you don't have any gaps where your face touches the mask. So ideally you want to have that little bit of flexible metal that can take a bend over the bridge of your nose and narrow out that potential for air to pass through. In DBH, we've had a face masking policy for a long, long time. That has been an important part of our safety measures in our workplace. That continues, and that's for all personnel. Now, there are, based on the new updated guidelines, we are strongly encouraging all of us to wear a surgical mask or the KN95 or N95. Strongly encouraging you. Those are readily available in our department, and we did get extra clarification for our whole leadership team, so I'll talk about that in a second. Strongly, strongly encourage you to use a surgical mask or a KN95. If you're unvaccinated, I'm not strongly encouraging you. You're actually required. Because we are a healthcare organization, if you're not vaccinated, there's a part of those health orders where you're required to use the surgical mask or the N95. So what that means if you're unvaccinated is you didn't get the original dose, either the 2-dose of Pfizer or Moderna or a single dose of the Johnson & Johnson, and if you're eligible for the booster, you didn't receive it. So that is what the definition of unvaccinated means in terms of the requirement to wear those specialized masks. Again, I encourage all of us to wear them, but some form of face covering is required over your mouth and your nose for all DBH personnel in our offices. And as I said, those are readily available. So we had our great leadership in DBH admin validate our inventory, and we have sufficient inventory for all of us to be able to receive a surgical mask if that's preferred, or that N95. So please do work with the administrative assistant in your division. And then you can also reach out directly to DBH HR. They'd be happy to accommodate. And then one last thing on the masking, because this is updated guidance related to the surgical mask compared to the cloth mask, we are asking visitors to our buildings to wear a surgical mask. So our management team is working to make sure that we have those surgical masks available at all of our entry points. And for field-based care at home and community-based visits, we're going to be working as a team, the managers are already working on this, to make sure that those staff who go out into our community have surgical masks available to offer to the person served. A few more reminders, and vaccination, again, is the theme right now. Language change came out from CDC because of the booster efficacy. Now we're saying, instead of saying fully vaccinated, we're saying that your vaccination is up to date. And so we used to say fully vaccinated before we saw the data to say that you were going to have better protection with a booster as time had passed. So now the language that we're trying to shift to is to say vaccination is up to date. Bear with me if in future updates I say fully vaccinated. Sometimes it takes me a little while to shift my language. So I appreciate your patience on that. Do remember to do your daily health screenings. There's an easy way to achieve that with an app. I encourage you to download the screening app. I believe it's gofresno.com. I think that's right. Brian can correct me. I think he's nodding over there. We think so. Somebody can put it in the chat. It's a really easy app. I try to remember to do that every single day. It's really valuable for our DBH HR team, and it is a DBH requirement that we do the daily health screening. Even if you're teleworking, it's really important because we need to be able to follow all of the rules for notifications and contact tracing in the event that someone tests positive for COVID. We need to know if you were in one of our buildings, and if so, which one. So really, really important. Every week, just about, we try to give everybody a reminder to stay home if you are sick. I think that people have gotten so accustomed to COVID, or maybe tired of COVID, that it's really easy to get comfortable and say, oh, it's just a headache, or oh yeah, maybe I just ate something that didn't agree with me and that's why I have stomach problems, or it's just the sniffles, I get winter allergies every year. Please stay home if you have symptoms. If you are not going to be able to, even if you feel really great, if you have symptoms that cause you to screen out, stay home. Work with your supervisor. We have testing available in our department all across the county, and so get a COVID test. It's really easy. It is so much better for you to have peace of mind and stay safe, and more importantly, follow the directions of the department, because I don't want anyone to be in trouble for coming to work when you are sick. That's been a directive, not just in my time as your interim director, but dating back as far back as I can remember with these weekly updates. Our former director, DeJuan, would say, stay home if you are sick. So please do follow that instruction. And one more reminder, DBH, you guys rock. You rock. I can't even begin to tell you how proud I am of this department and how proud I am to be a part of this department. As we get new mandates and new directions and new information, it causes all of us to have to pause, get regrounded, be flexible, and adjust. And you've really done an impressive job with that. Earlier today, before the noon hour, I was in a meeting with our leadership team, and so many managers were just really complimentary of how awesome you all have been. So if I can just have everyone do me a big favor, some of you may know this about me, there's one thing that gives me great joy, and it's if everybody goes whoop whoop, and give yourselves a big whoop whoop, because you've really been meeting us halfway, sometimes all the way, and so patient with us as a leadership team. And with sincere gratitude, I just want to thank you, not just on behalf of myself, but on behalf of the whole leadership team. It was actually the leadership team discussion that inspired me to make sure I include this in this presentation, and I really do just want to compliment all of you and thank you. We are all in this together. You know, this pandemic, we are coming up on 2 years. That's a long time. I know there's fatigue. I know there's pandemic burnout, if you will, and we are so resilient. We really are. I'm so excited about what 2020 has to bring. I'm looking forward to the surge being behind us, but it doesn't mean the pandemic is behind us, and so we just need to continue to be flexible and patient with one another. So really thank you all for that. I'm going to switch now to talking about things unrelated to COVID. Just a few things, we're almost to the end. There are some incentive funds coming our way for our clinical workforce. Multiple rounds potentially of incentives for our clinical workforce. All industries, really not just healthcare, but all industries have been hard hit by the pandemic. Gosh, I said I wasn't going to talk about COVID and sort of snuck that in, didn't I? But let's just be real, that workforce is a huge challenge across industries. Behavioral health workforce, people to deliver clinical care, and in this case, for this particular loan incentive, mental health care, is our backbone. Without a clinical workforce to provide mental health treatment and substance use disorder treatment, we don't even exist, right? This is why we are here. We are here to support all of our community in recovery and being well. And that takes clinical staff to do that. This particular pot of incentive funding is going to be for mental health workforce. I'm very hopeful that we're going to have more rounds that will have an expanded eligibility, so bear with me on that. But this one is for our mental health workforce, not just clinicians, but other disciplines as well. So that includes case managers and peer support professionals, nurses, doctors, and others. And it does require some certain eligibility requirements to be met, and there are terms and conditions. But in a nutshell, applicants who do receive the award would be eligible to have between $10,000 and $25,000 of their educational loans paid for. So that's a pretty big dollar amount, and so more information is going to come from our DBH staff development team. I anticipate that to come out early next week. Some of you may have seen this coming out through other discussions as well. But it is a great opportunity for clinicians to make a commitment to the public mental health workforce. Clinicians, case managers, when I say clinicians, I mean it more broadly. for all of our mental health workforce to stay the course in your commitment to serving the DBH persons served. This loan repayment application will be extended not just to DBH employed staff, but to other mental health workforce in our network of care. So that's our contracted organizations, for example. And as I mentioned, we do anticipate future rounds of workforce incentive dollars. I am very hopeful that we'll be able to expand that to our substance use disorder treatment workforce, and even also hopeful to really have that expanded even further for all of our administrative support teams. To be able to have those incentives as well. So bear with me on round one while it is a little more narrowly limited. And I do encourage any of you who are delivering mental health services and have student loan debt to apply for those incentives. Almost done. Now we're going to move to Getting to Know Susan, your weekly segment of an opportunity to learn a little bit about me. And I thought I would spend a little time talking about the therapist in me. So if you didn't already know, I'm a licensed marriage and family therapist, and I've been licensed for quite some time. I didn't always know that that's what I wanted to do for a living, but when I was in high school, my group of friends used to call me Dr. Sue. I am not a physician, nor do I proclaim to be a physician, just to be really clear on the record, but I was the friend in the circle that people went to talk about their troubles, and so they kind of jokingly called me Dr. Sue. But I didn't declare a major in psychology or counseling or anything like that. I was actually an undeclared major for 2 years when I was at Fresno State. I took all sorts of different classes because I didn't know what I wanted to do when I grew up, if you will. But I had an interesting professor who really inspired me to consider the field of counseling. And so I applied to graduate school, and I was fortunate enough to get in. What I didn't know at the time was that it was my calling to become a therapist. I lived at home with my folks when I was in graduate school, which I know is quite a privilege. It did allow me to mitigate my risks of student loan debt, and so I'm really privileged that I had that opportunity. But I would come home from class so fired up about mental health, about counseling, and about the ability for each one of us to sit in a moment of time with another human being who can help us in our journey of healing, growth, and recovering. And it was just inspiring. So I'm going to share with you what happened as a result of all of that enthusiasm that I had, because my mom used to joke around. She says, yeah, all I ever heard from Susan in graduate school was counseling. Try it, you'll like it. And so my mother, for a gift, purchased this license plate frame for my car. I had a little Honda Civic that was green, and it says counseling. Try it, you'll like it. And so I drove around town in my little Honda Civic with this license plate frame on it for years and years and years and years. And eventually I gave that car to my dad when he was looking for a car. And this now, if you wonder what is going on the wall where this license plate sits, it now has a home in the garage of my parents' home. When it was time for it to be retired, we didn't think that it deserved to go to the trash, and so it now lives where all of us can see it periodically in my parents' home. So that's a little bit of the journey of me being a therapist. Some who know me know that I never really take off that therapist hat. If you remember when I reviewed my top 5 strengths, one of them is empathy. And I don't think I've ever been able to lose the heart of a therapist, and I don't intend to. I know that that doesn't always land well with everyone, and I don't presume to be your therapist. I know my boundaries. I know them really, really well. But I ground myself as a therapist so that I can lead our department in the recovery and healing work in our community. And so I just wanted to share that with you, that I do try to approach everything that I do with the person served squarely center in our decisions. So with that, I'll remind you as I started off this presentation that we will send out a survey pretty soon, probably no more than 5 questions, super short survey. Hopefully it won't take you more than a minute or so unless you have a lot to say, which of course you're welcome to spend more time on it. And then we'll use that to craft how we go forward with weekly updates, and we'll open it up for questions. All right, let me scroll up. It looks like we have a lot of questions or comments. Let's see here. So great question about up-to-date vaccination. Is it after you get the booster, or is it 14 days after the booster? I'll have to read the research on that just to be sure, and somebody can feel free to put it in the chat if you know better than I do. I believe we are still saying that after you've had 2 weeks of that booster in your system, that's up to date. For the purposes of the public health order, as soon as you have the booster, then you are no longer required to test. Can we clarify this? Will N95 and surgical grade masks be mandated for all staff? Today, at this moment in time, at 3:38 in the afternoon on Thursday the 13th, it is not mandated for all staff. It is strongly encouraged for all staff to choose a surgical mask or the N95. For unvaccinated staff, it is required. There is the potential that that could change. So if you're viewing this as a recording, follow the instructions of your supervisor and any directions that are issued out through Dbh HR, because that is potentially something that could shift, perhaps outside of Dbh even. We're not quite sure exactly if that will become a mandate or not for our department or for broader than our department. Good question. And then, so I think there's someone asking about natural immunity. So yeah, there is definitely a hot debate in not just our country, but many countries about natural immunity versus the vaccination. I think the best thing for me to say for our department is that the health orders that we are operating under are requiring us to have the vaccine and the booster for almost all department staff. There are some exceptions. There is, for everyone in our department, the opportunity to have a medical exception with a doctor's note or a religious exception. So I know that there are people who have a very strong opinion that the vaccine is not grounded in science or is not necessary, and I'm not here to debate that with you. I am here to tell you what our requirements are, and my opinion, based on all of the research that I've done, all of the conversations I've had with public health officials, my own physician as well. And so just, again, always transparent. I am a big supporter of the vaccine for myself and my family because I believe all of the science that I've read, but each of us has to draw our own conclusions on that. I appreciate that. Can we get N95 masks distributed? So yes, and the N95 and the KN95, depending on availability, are distributed through your administrative assistant. But you can also reach out to Dbh HR, and the clinical managers and the administrative managers have all been working very closely with Dbh HR to make sure that those are accessible in all of our divisions. Ooh, we got some people giving us a nice whoop whoop. I like to see that. There's nothing that tickles me more than people going whoop whoop. So thank you for indulging that. Let's see. Oh, so let's talk a little bit about the return to work plan. I did talk last time, and prior to that, I had sent communication by email that we were going to do a 2-week assessment period to send some folks who were maybe hybrid or even full-time in the office, largely those with administrative roles. We were going to ask them to telework. We are still assessing that. And so we will communicate as that shifts. Right now, we're still in that 2-week assessment period. And even if I don't send something out to the whole department at the conclusion of that 2-week period, you'll get immediate direction from your immediate supervisor as we continue to try to ensure that we're addressing the needs of the people that we serve and managing this surge. So good question. We'll continue to communicate about that moving forward. Oh, very nice comment, thank you. And then next one, will a loan repayment work for individuals currently in grad school? And is DBH flexible with school schedules? So 2 questions. So there will be greater detail on eligibility in the communication that comes out from DBH staff development. I believe, don't quote me on it though, but I believe that a person has to be employed in the public behavioral health system in order to be eligible. So if you're currently in graduate school but not employed in the department, I don't believe that person would be eligible. Future rounds, maybe. So hopefully in the future. And then there's a question about flexibility on school schedules. We are in a place of great opportunity. Currently, we don't have the types of flexibilities to give part-time schedules or really significant schedule modifications. We have some modified schedules that we can do within the discretion of a manager, but we don't have the ability to do sweeping flexibilities. But I will say that you might recall that we were talking throughout the pandemic about exploring, the future of telework in the department and the future of flexible schedules in the department. I remain committed to exploring those. Those are decisions that are made in partnership with our colleagues in the main human resources department of the county, as well as the county administrative office. But we do see value in increasing flexibility in our workforce. We know that that adds value, particularly in care delivery positions. It also introduces some complications. Because we work with persons who have significant needs, we have to create layers of planning and team-based care, all things that we think are probably doable. It's just a planning process, and so I apologize that's not something that we've been able to move swiftly, but for a long-term vision, we do believe that flexibility is in our future, so bear with me. I wish that I could tell you what that looks like, but today it's a commitment of vision, but it's not a commitment in terms of being able to actually demonstrate timelines on when we might be able to execute on that. Okay, let's see. Proof of vaccination early in the week. So I'm going to ask you to rely on instruction from DBH HR. My understanding, and Helen might correct me, possibly might be texting me already, I believe that if you get your Relias module updated on Monday, once our DBH HR team and administration team is able to validate all of that, I think that you would be in compliance with the governor's order and would not have to test. That's what I believe is true. I'm going to look to see if maybe someone can validate that for me. Let's see. Oh, so a question about the testing site. Yeah, I hear you that the lines are long at the testing sites, and I want to ask for your patience with that. I think I must have lucked out. I tested on Wednesday. I work in the Hawk building, and that's where the testing is on Wednesdays. I lucked out. I walked right up. Literally, there was no line, and there was maybe 1 or 2 people waiting for their results. I think I just hit a sweet spot. I do understand from a colleague that the Pontiac campus had a really long line today. So I think it's going to continue to be long lines, which, that's a good thing and a bad thing. If you're the one in the line, it's a bad thing. But from the bigger picture public health perspective, the more people who are testing, the more data we have available to see what's happening with this Omicron surge. So I apologize for the long lines. We don't staff the testing sites. That's a contract that the county has entered into with an organization, but we can provide that feedback. I'm sure other departments are also providing that feedback, but we can provide that feedback related to the long lines. All right, what else do we have here? Okay, we have more. And there's a comment that ideally masks aren't meant to be reused. Yeah, that's a really important point also. And we're working to determine some additional resources to support folks in mindfulness about how to utilize our masks. Before we were using before the updated guidance on the surgical masks and the KN95 masks, a lot of us were using cloth masks. Like I said, I've used them throughout the pandemic. And those have to be washed. You can't let it fall on the floorboard of your car and your kid steps on it and then you think you've got a good, proper mask to use. I'm saying that playfully because that's happened in my car where I had a mask that was clean and then it was quickly not clean. But with surgical masks and N95 masks, let's use a hospital as an example. Our nursing staff would be better to explain this than myself. If you are working in a hospital and you enter a patient's room and they have an infection that aerosolizes, when you leave that patient's room, that person-served room, you would discard that PPE and then you would put on fresh PPE to go into another room. That's the gold standard. That is the best infection control measure. In our environment, in office settings and in outpatient mental health and substance use disorder care, given the complexities of supply and demand, managing our resources with the best available guidance from the Centers for Disease Control and the California Department of Public Health, we're balancing that high standard of infection control that our doctors and nurses use in a hospital setting and in a clinic setting for medical care against our environments, what we think is the viral load in our treatment settings. And so that's going to be a delicate balance. Our team is working with our colleagues in public health, and my guess would be that by next time we'll issue out some guidance on, based on supply and demand available, how can you best mitigate the risk of reusing a mask versus having a mask accessible to you. So that was a really good comment. And then I do have some additional questions and or comments. So Helen is validating that we are correct on the 14 days to be up-to-date vaccinated. And another helpful reminder from Helen Herrera, our administration division manager, I really appreciate that, Helen. When you're getting that mask from your administrative assistant, pardon. There is also a required training, so I really want to encourage you to support those administrative assistants and follow their instructions to take the required training. It's really easy, it's not very long, and it's a really important tool for you to be able to correctly be utilizing that PPE. Thank you, Helen. And here's another one. Let me make sure I understand this correctly. So somebody is giving us some feedback that they submitted their paperwork through Dbh HR regarding their verification of the vaccination and booster, and that there's been some back and forth email communication. And they thought it was taken care of, but they're worried about getting in trouble or having to test. And why are they still receiving emails from Relias saying it's overdue? That's a really important piece of feedback, and I want to explain a little bit about what happens. As I mentioned, our Dbh HR team and our Relias team, whenever we get one of these new mandates, it's an all hands on deck team approach. In fact, Helen was just sharing she's had to pull resources from other areas to support this effort, and she has a great team. But there will be a lag. If it was, all perfect in the world, technology would just automatically make all of us, aware that we're boosted. But it does take time for that to process through, and so do please bear with us. You're welcome to work with your supervisor to elevate your concern. I can appreciate that it is frustrating to have back and forth dialogue. We beg of your patience and your flexibility to kind of meet us halfway and understand that they are really working their fingers to the bone, trying to ensure that everyone's communication is responded to timely and accurately. So if you do still have a remaining concern, feel free to reach out to DBH HR supervisor level or your supervisor to ask for a little bit of support to resolve your situation. I do, again, ask for patience and flexibility and grace as we are really working feverishly to make sure that each employee of the department is in compliance. So very much appreciate the patience there. Let me see if I have anything else. Do we have to take the Relias booster attestation if we have a religious exemption? I think we talked about this last time, but I might not have been very clear. It is a new module, so you have to reattest for this requirement. Another bit of feedback, it would be great if the supervisors could have the N95s to pass out to their staff instead of the having to go places. One of the things is that that important training component we have to track, and so we're really wanting to have an organized, coordinated response to distributing this PPE. I appreciate that there's a lot of other ideas on what might seem more efficient and effective given the many different buildings in which staff work and the different demands of your duties. Again, gosh, I feel like a little bit of a broken record, but I am going to say I do appreciate the patience and that there may be some hardships, but we are trying to approach this from a very coordinated and organized response. And I assure you that each of the divisions is working very closely to support those administrative assistants and also working to have backup plans in case someone has scheduled time off or if they're out sick. So do bear with us as we're trying to have a coordinated approach. So there's another question about whether or not at-home tests are included in the data that we talked about, the case rates. They are currently not, and so Public Health is launching a way, I was trying to put my phone up here, sorry, I almost dropped it. Public Health, our colleagues here in Fresno County Public Health is launching, maybe already did launch, but is in the process of launching a way that at-home test results can be easily entered into our data systems. That might be accessible now on the Public Health webpage. I haven't looked at the Public Health webpage today, so I apologize. I don't know that at the tip of my fingertips. But that is something that's important to them because we know that the at-home tests are not currently factored in that data. So it could be more. We just don't have that data available to us. So really great question. The other thing I will say on that is that in some of the articles that I've been reading, and I'd be interested in what our epidemiologist thinks of this, there is some indication that we might not be relying on data like case rates moving forward through this pandemic because of those vulnerabilities in the data, that we might look at other things like just purely looking at hospitalization data or other metrics to indicate how we're faring in terms of a population health perspective. So really great question. And let's see. I think that's it there. Let's see if anything else popped up. Okay, let's see. I lost track of where I was on here because there's been more questions since I looked over here. As DBH employees, we can skip the line at UMC. We're lucky that we're getting paid time to stand in line, in my opinion. That is a nice perspective. So for the Dbh Testing Sites, so over there on the UMC campus, here at Hawk, and over, I believe also at Heritage, if I'm not mistaken, we are the priority. And I will say that Pinnacle and Dbh facilities team have worked hard to really increase signage and clarity, because I know last week there was a little bit of frustration in the line here at Hawk, at least. And boy, quick as a bunny, Helen and her team got signs up and made sure that it was crystal clear to all of the other testers in line that Dbh staff had priority. It's in the announcements that go out, just like at the Juvenile Justice Campus, probation staff have priority. At our sites, our staff have priority, and so we appreciate that is a bit of a privilege, and so so thank you for that comment. And is there time given for testing? I'm going to defer to Helen on that. If she's still watching, she might let me know. I do believe that testing time is, I'm going to let Helen answer that one. I'm going to double check my knowledge. I don't want to say the wrong thing. So Helen, if you're watching, give me a holler. And if she's not watching, we'll send that out by email. So there's a question about what options a person has in terms of their compensation if they test positive. Each individual circumstance is going to depend on what your situation is with working, not working, and so that's going to be something I have to defer to your supervisor and the DBH HR team to give you direction. And then next question. So is it, pardon me, that might be the answer to the previous question. And it is 1 hour available for you to get to a testing site, stand in line, get tested, and get back to your workstation. So thank you, Helen Herrera, for that lightning fast response to that last comment. Next question, is it a risk that you will become infected when you don't feel sick? And then if you might get an HR notification that you had an exposure. So you could potentially get a notification from HR that you work in a building where people have tested positive. That's not new. Those notifications have been going out throughout the pandemic. That is a requirement of Cal OSHA. And so we have been notifying people that, you know, someone in your building has tested positive, for example. It doesn't necessarily mean that you have an increased risk. You know, if we're following all of the guidance, our workplace standards are high. We've said that previously. Your risk should be reduced. You should have minimal risk. Now, is there a question in standing in the long lines? Is there risk in standing in the long lines to get testing? I would encourage you to keep your distance. I would also strongly encourage you that you're wearing a surgical mask or an N95 mask. And if someone is behind you and they're standing too close to you, I think you can respectfully ask someone to step back a bit to keep social distance or physical distancing. I think that's reasonable to do. All right, next. So someone is commenting like, why do we keep the Pinnacle contract and why don't we switch to at-home testing? We're not there yet in terms of inventory for at-home testing, not just in our community, but I think across systems. Many of you might be aware that some school districts have sent tests home for youth. Fresno County is actually working with the Restaurant Association to try to support restaurant workers to have testing kits available to them. But we're not at a place in Fresno County where we have the inventory or availability for at-home test kits for all of the staff. So that's one of the reasons why we're keeping that contract. Let's see. So a question about case rate and test positivity. So case rate is for our population, for every 100,000 people in our population, how many people have a COVID infection. That's case rate data. Test positivity means for all of the people that tested, for all of the test data that we have, what percentage of those tests were positive, right? So the more testing that we do, that can influence that test positivity percentage, right? Like right now, after the holidays, lots and lots of people wanted to test. That's part of the reason why we had such long lines last week, at least. So the more testing, the more data you have available, and you see that test positivity percentage slide around a bit. And then next question, does paid time allotted include travel time? Ooh, so this is another HR question. If you have to travel for testing, so if you're not at a work site that has testing on site, do you have to have the minimum insurance requirements? So I'm gonna have to defer to HR on that one as well, in terms of whether that travel time is going to be compensatable. The notifications. So there's a little bit of feedback about the efficiency of the notifications. Again, appreciate that not everything is happening in vivo real time as quickly as we would all like, but also very, very mindful that we're working as efficiently and effectively as we possibly can. So thank you for the feedback, and we will continue to do the very best we can to get those notifications out as quick as reasonably can. Appreciate that. I think that's it for YouTube comments. So if you have the situation related to a testing site not on your campus and you'd have to travel for testing, instructions from our DBH HR leadership is to have that conversation with your supervisor and they can get individual guidance for you. So please do raise that to your supervisor's attention. It was a great question and a really great response from Helen. Thank you, Helen. I think that, and it's 1 hour of allocated time for that testing. Just as a reminder, I think that's it for questions. We'll give it just one more second or two. Brian, do you see anything that I missed?
No, I think you got it.
I think we got it.
The last question is just referencing that if they're in the long line past an hour.
Okay, so if you're in the long line and it takes more than an hour, we're going to need to probably handle that on a case-by-case basis. Only 1 hour is the authority that's been given to us. So if you are in that circumstance, let your supervisor know, and then we'll address it through your supervision channels. All right. I think that is it for questions. Again, I want to just double down on what I said earlier about this department and how we rock. We really do. Give me another whoop whoop. I know some of you gave it in the chat. If you're at your desk or if you're maybe you're watching this, maybe you have nothing better to do on a Saturday night and you're hanging out watching Susan do the weekly update. I don't know. But give yourself a nice whoop whoop. Wrap your arms around yourself. Give yourself a big hug. And I look forward to seeing you next time. And please do be on the lookout for a survey. It'll probably come out from Tina Young early next week, maybe Tuesday, maybe Wednesday. Enjoy your holiday on Monday. And again, I encourage you to look at that video that was sent out from our Public Behavioral Health Division to find a moment of reflection for the observance of Dr. Martin Luther King Day on Monday, as well as Mental Wellness Day, month. I'm messing that all up. Take care of your mental wellness. Be kind to yourself. Shake off the rough stuff. We're going to get through this together. We're a great team. Be well, and I'll see you next week.